Today we will be going through the top 10 pandemics in history. We will see where they started and how many people they killed. Number 1. The Third Cholera Pandemic of 1852 to 1860. Death toll, 1 million. Cause, cholera. The Third Cholera Pandemic was generally considered the most deadly of the 7 cholera pandemics. It was also the third major outbreak of cholera in the 19th century and lasted from 1852 to 1860. Similar to the first and second cholera pandemics, the Third Cholera Pandemic originated in India, spreading from the Ganges River Delta before swiftly spreading through Asia, Europe, North America, and Africa. By the end it claimed the lives of over 1 million people. British physician John Snow was working in a poor area of London, and was tracking cases of cholera and eventually succeeded in identifying contaminated water as the means of transmission for the disease. Unfortunately, in 1854, the same year as his discovery, went down as the worst year of the pandemic, in which 23,000 people died in Great Britain. Number 2. The Flu Pandemic of 1968. Death toll, 1 million. Cause, influenza. The flu pandemic was a Category 2 flu pandemic sometimes referred to as the Hong Kong flu. The 1968 flu pandemic was caused by the H3N2 strain of the influenza A virus. This was a genetic offshoot of the H2N2 virus subtype. Even from the first reported case on July 13, 1968, that was in Hong Kong, it took only 17 days before outbreaks of the virus were reported in Singapore and Vietnam, and then within 3 months the virus had spread to the Philippines, India, Australia, Europe, and the United States. While the 1968 flu pandemic had a comparatively low mortality rate of only 0.5%, it still resulted in the deaths of more than 1 million people, including 500,000 residents from Hong Kong. That was approximately 15% of Hong Kong's population at the time. Number 3. The Sixth Cholera Pandemic of 1910 to 1911. Death toll, more than 800,000. Cause, cholera. The Sixth Cholera Pandemic was like its 5 previous iterations. The Sixth Cholera Pandemic originated in India where it killed over 800,000 people before spreading to the Middle East, North Africa, Eastern Europe, and Russia. The Sixth Cholera Pandemic was also the source of the last American outbreak of cholera in 1910 to 1911. American health authorities, having learned from the past, quickly sought to isolate the infected, and in the end only 11 deaths occurred in the United States. By the end of 1923, cholera cases had been cut down dramatically, although it was still a constant in India. Number 4. The Asian flu of 1956 to 1958. Death toll, 2 million. Cause, influenza. The Asian flu was a pandemic outbreak of influenza A. It was an H2N2 subtype of the virus. It originated in China in 1956 and lasted until 1958. In its 2-year spread, the Asian flu traveled from the Chinese province of Guizhou to Singapore, Hong Kong, and finally to the United States. Estimates for the death toll of the Asian flu vary depending on the source, but the World Health Organization places the final tally at approximately 2 million deaths. 69,800 of those deaths were in the US alone. Number 5. The flu pandemic of 1889 to 1890. Death toll, 1 million. Cause, influenza. Originally called the Asiatic flu or Russian flu, this strain was thought to be an outbreak of the influenza A virus subtype H2N2, though recent discoveries have instead found the cause to be the influenza A virus subtype H3N8. The first cases were observed in May 1889 in 3 completely separate and very distant locations. The locations were Bokhara in Central Asia, which is now Turkestan, Athabasca in northwestern Canada, and Greenland. Rapid population growth during the 19th century, most specifically in urban areas, only helped to spread the flu virus. It was not long before the outbreak had spread across the entire globe. Though it was the first true epidemic in the era of bacteriology and much was learned from it. In the end, the 1889 to 1890 flu pandemic caused the death of more than 1 million individuals. Number 6. The Antonine Plague of 165 AD. Death toll, 5 million. Cause, unknown. The Antonine Plague was also known as the Plague of Galen. The Antonine Plague was an ancient pandemic that affected most of Asia Minor, Egypt, Greece, and Italy. The plague is thought to have been caused by either smallpox or measles, unfortunately though the true cause is still unknown. This unknown disease was transported back to Rome by its soldiers returning from the war in Mesopotamia around 165 AD. Unknowingly, they had brought a disease with them that would end up killing over 5 million people and would destroy the Roman army. Number 7. The Plague of Justinian in 541 to 542 AD. Death toll, 25 million. Cause, bubonic plague. The Plague of Justinian was thought to have killed nearly half the population of Europe. The Plague of Justinian was an outbreak of the bubonic plague that affected the Byzantine Empire and Mediterranean port cities. It ended up killing close to 25 million people in its year-long spread. Generally regarded as the first recorded incident of the bubonic plague, the Plague of Justinian left its mark on the world, killing up to a quarter of the population of the eastern Mediterranean and devastating the city of Constantinople. When it was at its height, it was estimated to have killed almost 5,000 people per day and eventually resulted in the deaths of 40% of the city's population. Number 8. The HIV/AIDS pandemic during its peak of 2005 to 2012. Death toll, 36 million. Cause, HIV/AIDS. HIV/AIDS was first identified in the Democratic Republic of the Congo in 1976. HIV/AIDS has proven itself to be a global pandemic. It has killed far more than 36 million people since 1981. Currently there are between 31 and 35 million people living with HIV, the vast majority of those are in sub-Saharan Africa, where roughly 5% of the population is infected. This equates to almost 21 million people. As social awareness has increased, new treatments have been developed that make HIV far more manageable. Many of those infected go on to lead productive and long lives. Between 2005 and 2012, the annual global deaths from HIV/AIDS dropped from 2.2 million to 1.6 million. Number 9. The flu pandemic of 1918. Death toll, 20 to 50 million. Cause, influenza. The flu pandemic of 1918 occurred between 1918 and 1920. During this time there was a disturbingly deadly outbreak of influenza that tore across the globe. It infected over a third of the world's population. It killed roughly 20 to 50 million people. Of the 500 million people infected in the 1918 flu pandemic, the mortality rate was estimated at between 10% to 20%. It was recorded that there were up to 25 million deaths in the first 25 weeks alone. What separated the 1918 flu pandemic from other influenza outbreaks was the victims. Where influenza had always previously only killed juveniles and the elderly or already weakened patients, the flu of 1918 had begun killing strong and completely healthy young adults, while leaving children and those with weaker immune systems still alive. Number 10. The Black Death of 1346 to 1353. Death toll, 75 to 200 million. Cause, bubonic plague. The Black Death was from 1346 to 1353 and was an outbreak of the bubonic plague. It ravaged Europe, Africa, and Asia. It had an estimated death toll between 75 and 200 million people. The Black Death was thought to have originated in Asia. This plague was like most plagues in that it most likely jumped continents via the fleas living on the rats that frequently lived aboard merchant ships. With ports being major urban centers at the time, were the perfect breeding ground for the rats and fleas, and thus the deadly bacterium flourished, devastating 3 continents in its wake. Thank you for listening to the Top 10 Pandemics. If you liked this video, please hit the like button, and if you want to watch more videos, and be notified of when new videos are posted, please hit the subscribe button below.